Let's get in the management of Narayana Hrudayalaya and try and understand what's happening in the sector.
Dr. Devi Shetty joins us right now. Needs no introduction. He's probably one of the most well-known faces when it comes to the world of health in India. Thank you so much, Dr. Shetty, for taking out time. You know, everyone knows you as someone who's worked out how to provide low-cost health in India, how to give people low-cost medical insurance. But the stock markets are notoriously heartless. They think that that is just not something you should be doing. You should be charging. What I would like to know is, how does one make money for investors by charging people less for medicine?
First of all, the first message I want to give to everyone is that charity is not scalable. Good business principles are scalable. Look at mobile phone companies. They are not-for-profit entities, but they are offering services to the poorest of the poor people of the country. We need to have a scalable model of delivering healthcare, because unfortunately in India, more than 60 to 70% of the healthcare expenses are borne out of pocket. People are not in a position to pay for the healthcare. So if we can have a large-scale model where we build thousands and thousands of beds and offer quality healthcare at affordable price, we can have an extremely successful model, because you have to realize we are 1.2 billion population. We have an exciting opportunity.
But Dr. Shetty, you know, if I compare the other listed private hospitals and the numbers that are crunched out say that each bed per year, the total amount of assets that go into running that bed costs about 70 odd lakhs, 70 to 80 lakhs per bed, what is called gross block per bed. I understand that when you come to Narayana Health or Narayana Hrudayalaya, that comes down to 25 lakhs. How do you manage that?
You have to look at a different way of planning, building and managing hospitals. So we are very conscious of the money. We know that the majority of the country's population cannot afford the charges levied by most of the corporate hospitals. And people need to survive. They need someone to offer them the health care. We believe that if we can maintain the similar cost of infrastructure and offer healthcare at affordable price, we have 1.2 billion population at our disposal. It's a huge market. It is nothing but economy of scale.
But you know, that's what I would like to understand, Dr. Shetty, that if it costs you 1/3 per bed, how is it possible? How are you managing to do that? I understand you're saying economies of scale, but your scale is not higher than, let's say, some of the competitors who are listed.
See, our entire approach, our overheads are very less compared to the typical corporate hospitals. Okay. And we don't generally buy the land from the market. We generally tie up with the government and get the land at a affordable price. Or we tie up with the real estate people at a kind of a not unrealistic expectations, because they know our model and we give value to those real estate developments because of our model, and all the governments want to tie up with us. So we get consideration from the government. So essentially when the target population is different, you are approaching a different set of people. You are approaching the governments, you are approaching people with the charitable bent of mind. So the entire equation changes.
But you know, when people put money in the stock market, you came out with an IPO and you raised money, they generally, a stock market investor generally doesn't even care what the companies, all they look at is the returns. That is something that one wants to know, that if, let's say, currently I think you do about margins of about 13 odd %, and your best margin, the ones which are already mature businesses, the mature hospitals, have gone up to about 24%. How do you manage to keep that margin up? What is the secret?
It's just nothing but utilizing your infrastructure for about 12 to 14, 16 hours a day, and utilizing the infrastructure 6 days a week instead of the 5 days. Because infrastructure is the biggest cost in healthcare. So our doctors are very conscious that our patients can't afford to spend that kind of money. So if we buy a CT scan, we want to utilize it to the maximum. If you buy a cath lab, we want to use it for 14, 16 hours a day. So essentially, what we do is to get the maximum out of whatever investment we make. At the same time, we are cognizant of the fact that for the stock market, they want good return on investment, and we can maintain the industrial standards. We can assure that we are not going to disappoint them. But how we do it is different.
Do you think that some of the bigger hospitals have overspent on machinery and capacity? Not capacity definitely, but machinery, which is not really required?
See, the machinery is required. We have got the similar equipments as other hospitals. Okay. It is just that we sweat our machinery much, much more than the other hospitals. We try to run it for long period of time. We start using it. We use it for 10, 12, 14 hours, sometimes on weekends also. So we get the maximum out of the investment what we make. There is no magic in this business. You have to just, you have made an investment, you have to get the maximum out of it. That will only happen if the doctors are convinced with your ideology. Doctors inherently want to care for the people. That's the reason why they became doctors.
So
you
look
create
for
an environment wherein...
who are good doctors who are willing to come for lower salaries?
No, we don't pay them low salary. We pay as much as the industry salary is. But we get them to work twice or thrice more. Okay. Their productivity is significantly more. That's the reason why it compensates.
All right, so you
can't pay doctors less salary.
Industry rates, but they are willing to work more and volumes are higher. But if I look at even your mature hospitals, Dr. Shetty, bed utilization is still at about 70%. I mean, how would that fall into the category of capacity utilization?
You see, when our cost of adding bed is significantly less, so if we need, say, 300 beds, when we build 500 beds, 600 beds, knowing fully well that it may take quite some time to go for the entire 100% occupancy. Because adding the bed later on is expensive, because every day the construction cost goes up. And in a functioning hospital, adding bed adds to significant inconvenience. So virtually most of our hospitals, we have built-in capacity to increase our occupancy by 30%, 50%. So that is our strength. Like we can grow every year for at least in the existing place for at least another 4 to 5 years without adding another building.
Dr. Shetty, you speak to doctors when they're being candid, and a lot of them who command very high salaries in private hospitals, they admit that there is a person with an Excel sheet who comes once a week and asks them how many tests have you recommended, and that kind of forces them to recommend tests. That's how private hospitals keep their machines running. That's how they maintain capacity on tests and path labs. Now, they are forced to do this to get returns on their investment. I'm still trying to understand that how is it that you manage to do that without charging high for tests?
See, our idea is that the patient should spend as less as possible. And he will spend as less as possible if you do the minimum number of tests what is required. Because most of our patients, a good number of our patients are under the government scheme. And if you do more tests, you're not going to get more money out of them. Okay. So there is a kind of a culture which is built in with the organization that we have to save money for the patient. without compromising on the quality. And that is a culture of the organization. So we have no problem in controlling the doctors. Obviously, they are very clear that we are not interested to do things what is not required. If a patient doesn't require a stent, he doesn't require a stent. Just because he is going to give you more money, if you put in a stent, it is not right. And what is not true is not sustainable.
So would it be right to say that just in terms of a business, this is mainly based on volumes, proper utilization of your equipment, and getting in tie-ups with governments and trusts? Would that be the right way to look at it?
Yes, I agree, and I have forgotten something very, very important, the ideology and the philosophy. Because ultimately that's what binds all the people together. That's the reason why people don't mind working till 10 o'clock at night, even on Saturdays. There is a purpose. We forget the power of purpose. Healthcare industry is not like other industry. We are dealing with human lives. We have a responsibility towards people's life. People have no choice.
One final question, Dr. Shetty. Critics of Narayana Health Care, they say that Dr. Shetty shows, shows the difference in pricing between marquee surgeries. So let's say a bypass costs very little, prostate operation costs very little at Narayana Healthcare, but everyday visits and things like that are not really that differentially priced. What would your answer be to that?
See, we are only looking at, we are not breaking things into separate pieces and analyzing it. All we are trying to do is to say how much a patient pays for the procedure.
Yeah.
Because we are a procedure-oriented hospital.
Okay.
We want to do varieties of operation, large number of operations at a price what they can afford. Now, in some areas, we may be as expensive as the others. But what hurts the patient is the procedure cost. And that is where we score.
All right. Dr. Shetty, thank you so much for taking out time for us. And it's a great model. Hope you succeed. Thanks a lot for joining NDTV Profit.